morning. My name is Melissa Smith. I'm going to be your nurse practitioner today. What's your name?
My name's Adeline Smith.
Hi, Adeline. So we provided Adeline with some privacy already, and we have done her vital signs when she came in. They were within normal limits. We checked her height and weight. Her BMI was normal. Her hygiene is good. Her skin color, it looks healthy. She has an upright posture. She has an athletic build. Her affect is good. She seems like a happy kiddo. We're gonna test your cranial nerves 7 and 12, okay?
All right.
Could you puff out your cheeks? Could you smile? And then clench, raise your eyebrows for me. Alrighty. Could you stick out your tongue? Alright, and move it side to side. Alright, good deal. Can you close your eyes? Alright, that's good. We'll set these over here. Alright, tell me if you feel this.
Mm-hmm.
This,
Yes, ma'am.
this.
Yes, ma'am.
Okay, good deal. You can open them. I'm just going to check your head, okay? So her skull is normocephalic without any obvious deformities or lesions. I'm going to move on to feeling in your hair, okay? No lumps and bumps. I don't see any nits or scaliness. Her scalp looks healthy. Her head looks healthy. I'm going to check your sinuses, okay? Just tell me if this is tender. You good?
Mm-hmm.
All right. Then we'll move on to your eyes.
All right.
So we don't have the charts here, but we would do the Snellen chart and the Rosenbaum chart, and those are for cranial nerve 2 to make sure that's intact. The Snellen is for far away, the Rosenbaum's for up close, and you needed glasses, so obviously you would have to have your glasses. Can you tell me when you see my fingers?
No.
Okay. Again.
No.
All right. And here.
No.
All right. And we're going to test cranial nerves 3, 4, and 6. Okay. If you could just follow my finger. Good job. Alrighty. I'm going to have a look in your eyes. Okay. All right. Those cranial nerve reflexes. Corneal reflexes are good. The light shined equally in both eyes. And I'm just going to check here. Look straight at me. Alrighty. Okay. Her eyes look good. We're going to move on to your nose, okay? Her nose is symmetrical. The skin looks healthy. Can you close one side? It's okay. Second. All right, the other side. So her nose is patent. Could you close your eyes for me? Tell me what you smell.
Perfume.
Alrighty. Olfactory nerve is intact. I'm gonna have a look in your nose, okay? Could you lean your head back? Alrighty, so there's no drainage. Her septum is midline, it's not deviated. Her nose looks good. We'll move on to your ears, okay? I'm gonna have a look at them. Ears are symmetrical. Feel of them. Alright. Those lymph nodes, any of that tender?
Mm-hmm.
No? Okay. Could you cover up one ear for me?
ABC.
Alright, other ear.
1, 2, 3.
Okay, good job. I'm gonna have a look in your ears, okay? This doesn't have a light, so I'm just pretending. Alright, so her tympanic membrane is intact. There's no drainage in the canal. Tympanic membrane is not bulging. There's no fluid behind it. Same for this side. Both ears are normal. The Ryan and Weber test. This is my tuning fork, not a real fork. I would hit it, and you would tell me if the sound is equal in both ears. And I would hit it and put it behind your ear on this bone, and then out here, and you would tell me whether or not you hear it louder out here or behind your ear. But we can't use the fork. So, alrighty, we'll move on to your mouth. Her lips are pink. I don't see any obvious lesions. Can you open your mouth for me and let me have a look? Alrighty. Well, here's my tongue depressor, aka spoon. Alright, say ah. Alrighty, her uvula. Let me have a look with a light. One more time. Alright, the uvula rises and falls. in the midline, and her teeth are without cavities. Her mucosa is pink. Her mouth looks healthy. Her hard palate and soft palate are both intact. And the mouth looks good. So moving on to your neck. Her neck is symmetric. Can I have a feel?
Mhm.
I don't feel any lumps or bumps. I'm gonna just have a feel of it. I'm gonna listen right here. All right, could you hold your breath for me? Okay. And this side. Hold your breath again. All right, I don't hear any bruise. Let's turn your neck to the side. All right, no pulsations there or there. Good deal. Let me feel these lymph nodes, okay? Just tell me if it's tender, all right?
Mm-mm.
Any of it?
No, ma'am.
Okay. Not even that? All right, her lymph nodes are round, movable. I don't feel any problems with them. Okay. Can I just feel right here? Could you swallow for me? Alrighty, her trachea is midline, no deviations. Her thyroid is without nodules that I could feel. Her neck looks good. Alright, we'll move to your chest. The configuration from her lateral to AP diameter is normal, a 1.2 ratio. I'm just gonna rub, okay? No obvious lesions or bumps. We don't want to take our shirt off, right? Alrighty, the symmetry of the shoulders, the left side is down some because she has a special arm. That's okay, it accommodates for it. I'm gonna have you say 99, okay? Remember?
99.
Alright, can I do it in the back? Okay, go ahead.
99.
And again?
99.
Okay, good deal. I'm gonna have a listen while we're back here, okay? So she has no tactile firmitus. Have a listen. Take a deep breath. And again. And again. And here. Okay, you can face me. Just gonna listen under here. Deep breath. Go ahead. You can just breathe normal. Alright, I'm gonna go back here again. Could you say E for me? When you feel it touch your back. Say E for me.
E. 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 E.
Okay, I don't hear any agaphony. I'm gonna tap on your back, okay? You can turn some more, maybe. It's more comfortable. Alright. Feel like I'm beating you up. Okay, breath sounds normal. Let me tap in the front too. I don't hear any adventitious sounds. Her lungs sound good. Alrighty, sounds good to me. I'm gonna check your heart, okay? I'm gonna have a listen. S1, S2 noted. That's under here. Alrighty. Just gonna feel here, okay? No lifts or thrills. I'm gonna feel under here, okay? PMI. Alrighty. I'm gonna tap on your chest, okay? It's hard to tap under here. Here we go. You're good. Alright, you can lay down and we'll check your belly. This is where you get the giggles, huh? Alright.
That's what I got too.
It's okay. Alright, the contour and symmetry are good. I don't see any obvious lesions or bumps or sores. I'm gonna have a listen first before I start poking on you, okay? Ideally, I'd listen for a minute in all 4 quadrants. She has active vowel sounds. They're a little bit noisy. Since she just ate, huh?
Mm-hmm.
Alright. listen to the blood flow. Iliac, renal. And I would listen to the femoral, but I'm not gonna do that. All right, I'm gonna start pushing, okay? Just tell me if anything is tender. I don't feel any masses. She's about to get the giggles. All right, let's be a little deeper. Still no masses. Alrighty, I'm gonna feel for that liver. It's not enlarged. For the spleen, no splenomegaly noted. Alright, I'm gonna press in and you just tell me if it hurts when I let go, okay? No pain? Okay. Can you take a deep breath? Any pain there? Okay. I'm gonna press on this side. Does it hurt on the right side? Okay. Can you turn on your left side? Alrighty. Good deal. You already did it yourself, huh? That means we've practiced. Alright, does that hurt? Alrighty. Can you lay on your back? Okay, just gonna feel this leg. Alright, does that hurt? Nothing in your belly? Alright, can you sit up for me? I'm gonna tap on your back, okay? Both kidneys, that didn't hurt? Okay, good deal. Now, you can put your feet over here. We're gonna look at your arms and legs and stuff. Alrighty, so her upper extremities, they are different. There is a missing radius on the left side. She is missing one finger, her thumb on the left hand. She was given a special arm. There are some scars on the arms. They're all healing. Scars on this arm, they're all healing as well. The color matches her ethnicity. There's a tattoo on the right arm. Don't quit, it's cute. Could you put your hands up for me? And then to the side and forward and turn them this way. All right, hold your arms out. Don't let me push them down, remember? Or up. Okay, out here. All right, pull, push. All right, can you put this hand, open it for me? All right, don't let me squeeze your fingers, okay? You hold them out. Yeah, good job. Now, squeeze my fingers. Hard as you can. All right, good deal. That's awesome. Can you, we're not gonna do the baleen side. We'll just do this one. Tell me if this, does that cause any tingling or numbness in your hand? Okay, we're not gonna do the other hand. Can you do like this maybe? Yeah. All right, does that cause any pain or any tingling in your hand? All right, so there no carpal tunnel. Your arms are good. Alrighty, so we're gonna look at your lower extremities now. There are some sores on her legs that are healing as well. The color is good for her ethnicity. I don't see any, no swelling in the extremities, no redness, no signs of vascular issues. I'm gonna take all the pulses, okay? So brachial, and then radial pulses. And then I would do femoral, but we won't. We'll do behind the knees. Sorry, girl. And we'll do down here. And then we'll do your feet. Alrighty. Can you push up against my hands? Alrighty. Can you push down like a gas pedal? Alright. And now pull your legs back towards you. There you go. Push against me. Oh, good job. Alright. Push up. Another one. Yep. Good job. Can you lay on your back and we're going to see if those legs move around. This way. Oh. It's okay. We're just going to see. Remember when we move your legs around? All right, just tell me if this hurts. No? Okay, good deal. I'm going to move the hip in and out, okay? All right, other side. Any pain? Okay. The hip in and out. You say quit, huh? Alrighty, you can stand or you can sit right here, baby. Okie dokie.
Gesticulation, all this.
I know everything. Can you close your eyes for me? Tell me if this finger is up or down.
Up.
All right.
Down. Up.
Okay. Let me do the other one too.
Up.
Can you look at me? And I want you to touch your nose and then touch my finger. Good job. Do it again. Good job. All right, again. Okay, good deal. All right, you want to try to do it with the other hand?
Mm-hmm.
Okay, go ahead. Awesome. Down here?
I stay looking at you?
Yeah. No, you can look.
Oh, okay.
Yeah, you're just so that you can touch. It's making sure you have the coordination, the balance, and that your faculties are all there. Okay, good deal. Can I look at your back?
Oh.
Just want to see that your spine is in alignment. All right, your spine looks good to me. You can stand up for me. We'll do some shallow knee bends. You feel like you're exercising? All right, could you sit down for me and let me do your reflexes real quick? Totally forgot. But this is my reflex hammer. We would do them back here, right here. We would do the other side. Then we would do here, and we would do. That's all. All right. Could you walk across the room for me?
Mm-hmm.
All right. Come back on your toes. All right. And then on your heels.
To where? Right?
Back over there, yeah. All right, good deal. And then come stand right here. All right, can you put your hands beside you and then just close your eyes for me? All right, so her Romberg test is negative and my patient is all healthy. Smile.